Welcome to the Motivational Midwife. My name's Lynn Jones, and today we're going to look at some strategies for revising for exams. So when I was recently down in Cambridge, a student asked me if I would put something together for revising for exams. And apologies for the delay in doing so. Life has kind of got in the way. So what I thought I'd do is actually go through a few things that I've found useful that have helped me when I'm revising for exams. And hopefully they'll be of use to you as well. So the first thing maybe to think about is what types of exams you can have. Now, there are many, many types of exams, but within a university setting, these, certainly for healthcare, excuse me, these tend to be the most common. So first of all, you've got your essays, and your essays could be a long essay or short essay answers. Your OSCEs, which is your observed, structured clinical examinations, these tend to be much more practical in nature. And more skills-based. And then you've got multiple choice questions. And then lastly, you'll have vivas, so more of an oral exam. So let's look at some of the obstacles particularly. So both for myself and certainly as a lecturer, I have found that cramming generally doesn't work. Spending hours and hours trying to revise something generally doesn't work. Your brain will only hold a certain amount, and then you're going to switch off anyway. Leaving things to the last minute. Now, there are a few people, I do have some colleagues who can leave an essay to the last minute, and then they can crack out an A-star essay, no bother at all. Unfortunately, that's not me, and I totally think it's not most people that are students as well. So leaving things to the last minute for revision generally doesn't work. Certainly when I was doing my midwifery, I had 3 small children, and I had found that I had to actually do some revision every night, every day, except when I was on holiday. On holiday, I didn't do anything. I completely put the books down and left it. But I would try and spend an hour every day looking at something, because I'm personally not one of these people that can just read a book and then it's in there and I remember it forever. So I say last minute cramming and last minute revision doesn't work for me, and in my experience it doesn't work for most people. Procrastination. Now I'm very good at this. I'm very, very good at procrastination. So for those of you that are not sure what that is, that's kind of putting off. So you're saying, right, I'm going to do this today. I'm going to sit down and do this. And then you'll find 1,000 reasons not to get started. So maybe I'll just pop the washing on first. I'll just nip to the shops first. Or I'll just read this little bit in a book first. I'll just, and so the list goes on, and you'll find it's very, very easy to procrastinate. And I'm an expert at that. One of the things I think we are all guilty of is revising what you know, and that's not really that helpful to you. But it does make you feel good when you're revising something that you know. So really, when we're revising for exams, you need to focus on the things that you are not so confident with and put the things you are confident with slightly to one side. Doing it on your own as well can be, although most of us end up revising on our own, it can actually be counterproductive. Sometimes having a buddy to do your revision with can be quite helpful, because if you're learning something or revising something and you haven't got it quite right, if you're on your own, there's no one there to say, oh, hang on a minute, isn't that A, B or C, not D, E and F? So it can be quite useful to have a buddy to actually revise with. And then maybe not using, I've got this on obstacles, but either not using or using the wrong sort of tools and revision aids for what you're trying to revise, because it's not one size fits all. Not all tools and things will help you with all particular types of exams. Okay, so when we're looking at essays, you have both short essays and long essays. In an actual exam situation, it tends to be more short essays. Long essays tend to be more of a assignment exam. And you actually, by virtue of the fact that it's more of an assignment, you have longer to do it. But I have still found that this acronym scales can be quite helpful, particularly in looking at the role of the midwife, and every answer to some extent shall have the role of the midwife embedded in it. So first of all, you've got with your short essays, and your long essays as well, but particularly from a revision point of view, with your short essays, it's quite crucial that you look at the marking criteria that is linked with the particular exam you're going to be set doing. And then for each of the topics that you think you may get within that exam, write 8, 9, 10 key things that link with those marking criteria. So say if you've got diabetes, write 10 key things that link with diabetes and that marry up with the marking criteria. They just need to be short, snappy answers, because believe it or not, once you've got a starting block, so that first sentence, other things do come when you start writing. And if you've got those 10 key points, you can add to those relatively easy. And it also makes it much easier to revise if you have short, snappy sentences to look at. It's much harder to do that if you're trying to read long, rambling paragraphs on things and retain that. So linking everything to our role of the midwife in some way, shape or form, I would say pretty much every essay exam that you ever do should involve reference to the NMC Code of Conduct and proficiencies for registered midwives. Because these are our statutory requirements. This is our governing body. It's what rules our practice and governs our practice as midwives. And if we fall short of those, they are what we would be judged against if we were ever referred to the NMC for misconduct or anything else. And then you've got your clinical role. So what sort of actual skills and clinical things are you doing as a midwife in the situation that the question is requiring? So say it was a question around antenatal, an antenatal appointment, then it might be things like your maternal observations, urinalysis, abdominal examination, checking blood results, taking bloods, all the clinical things that you actually do. And then when we're looking at advocacy, if you know, being an advocate means really you're fighting her corner for her. And part of that fighting the corner for her will be supporting her in her choices. However, if we have not given her evidence-based information to make those choices, then really, you know, she isn't making informed choice. So I always clump that sort of giving evidence-based information along with the education role as well, and being an advocate for the woman. Now, you can link this quite nicely with your statutory requirements. The NMC always, within its code of conduct, refers to our clients as patients because it's for nurses and midwives. So it does say, you know, we are obliged to make sure that we provide evidence-based information, and that is going to change probably much more frequently than trust guidelines or national guidelines do. But we need to make sure we are signposting and giving women and their families evidence-based information to make an informed choice. But our NMC Code of Conduct also states quite clearly that patients are quite within their rights to decline our advice. And yesterday I was caring for a woman who had chosen to decline vitamin K for her baby, and she had been given all the information to make an informed choice, and so therefore that was her choice. And I have to respect that choice. I did check with her that she had been given all the information and evidence-based information to make that informed choice, which she had, and therefore I have to respect her wishes not to have vitamin K for her baby. And then your role as a midwife liaising with the rest of the multidisciplinary team. So that will be very much dependent, who that is will be dependent on the question that you are trying to answer. So that might be diabetic specialist nurses, it might be dietitians, it might be the obstetrician, it may be mental health team. There are a variety of people. It may be physiotherapists that you are liaising with in order to support the woman and her choices and answer the question from an exam point of view. Then your role as an educator. So again, this comes back to evidence-based information, but also it could be education around healthy eating in pregnancy, around her fetal movements, when to contact the hospital. It could be around labour and birth. Depending on what your question that you are trying to answer, there will be an element of education, your role as an educator within it. And then support, your role as a support for the woman and her family, but also what support do you need as a midwife to carry out your role. So looking at OSCEs, now personally, I like an OSCE because I'm very much more a practical person. I find that a sort of see one, do one exam type situation suits me and my learning better. I'm less comfortable with long essay writing. I mean, I have colleagues who can knock out an essay in an afternoon and it can get an A star, but I definitely can't. So OSCE situations often do suit people like me who are more skills based in nature. They're more practical, so they can demonstrate and do the things which they find harder to write. And they're often very much easier to revise for because they're shorter than an essay. Your OSCEs usually are between maybe 10 to 30 minutes long, so you have quite a narrow time frame in which to do them. Very often a lot of the OSCEs are based around some of the emergencies, or maybe infant feeding is another one I'm familiar with as well. So you can, when you're revising for OSCEs, you can usually be quite short and succinct with your key points that you need, because often a lot of it, the OSCE, is around the management of a particular situation, so you can focus on that and then work out, depending on again what your marking criteria is looking for. It's very often going to be looking at communication skills. So when you're revising, think about the language you use, think about actually demonstrating how you communicate with the woman and her family, and how you communicate with the wider team. Yeah, I do like an OSCE personally. I'm a fan of it. And obviously, you're less of a fan when you're on the other side of it, but I do quite like an OSCE. Multiple choice questions. So really, when you're revising, you need a broad knowledge for these. And when you have a multiple choice paper, in general, you know that 50% of those answers are going to be obviously wrong. which means that you generally have a choice of 2. So even if you didn't know the answer, you have still got a 25% chance of getting it right. And if you know the ones that are obviously wrong, you've actually got a 50% chance of getting it right, because you know that it's going to be a choice of the 2 that are left. Revising for MCQs, a lot of MCQs I've noticed are often sort of done for anatomy and physiology. They can be done around the sort of emergencies as well as a multiple choice question paper. So, and the emergency would be your underpinning knowledge for things, so risk factors for certain things. And again, I would say you need to, for this, you do need to really be doing a little bit every day on a particular topic. To get that sort of broader knowledge. Wherever you can, try and link it to something you've seen in practice, because if you can link a topic to something, a woman you've looked after, it very often stays in your brain a little bit more. So what did you actually do for that woman? What was the management of that woman? What was the care pathway for her? So Vivas, I've never really had to do a Viva as a student, because they didn't kind of exist really as an exam when I trained. But they are good in that you don't have to worry about things like spelling and grammar. They are sometimes easier to revise for, because you generally have quite a narrow range for a Viva of things that you're going to have to be speaking about. So, for example, with NIPE, you've got your 4 standards. So it would be based around the 4 standards and some of the more common conditions that link with those standards that you might see. It could be infant feeding. Again, it's quite a narrow range, so it makes revising for those easier. Again, excuse me, I would say, buddy up with someone to do these. When you're revising for Vivas, actually talking to people can get quite nervous before an oral based exam, and so sometimes you may find it quite useful to do some sort of relaxation before your exam, so a bit of meditation, a bit of yoga, or just sitting quietly listening to some quiet music, or just doing some deep breathing to just get you calmer before you go into an oral based exam. It's easier, I think, to revise for, in that the tricky bit about Vivas is actually making sure that you get everything you want into the time that you've got, because often they're quite short exams. You don't have much time to get your information across. Again, make sure you look at the marking criteria so that you can make short, snappy points about each thing that needs to be in the exam that you need to get across that will meet that marking criteria. It's sometimes worth, when you're revising for Vivas, to record yourself. So either, just audio, record the audio, and then listen to yourself back and mark yourself against the marking criteria, and see how many bits you actually got in, and if there was any areas that you perhaps missed out. Also, that gets you used to talking out loud, saying it out loud, because saying things in your head isn't the same as saying it out loud. I know that's kind of obvious, but it isn't the same as saying it out loud. And actually hearing yourself saying it back, recorded back to yourself, can sometimes highlight where you're perhaps missing things out, or where you maybe need to put more emphasis on something. So some tips for it. Firstly, don't overload yourself. Don't, give yourself too much to do in one hit, because in my experience, all that will happen is you will just burn out revising, and you won't actually achieve anything. Some people find mind maps quite useful. Gantt charts were something that I hadn't heard of particularly until I came to teach at the university. And I wish I'd had somebody show me them when I was a student, because it would have made life easier. They can, I mean, you don't have to stick to them 100%, we will go through it, but they can make balancing everything out a little bit easier. And then there's the use of visual tools, which is my particular favourite. So here we've got a Gantt chart, and as you can see, it's just days of the week and on the top, and the whole day divided into hour segments down the left-hand side. And you can fill I've only filled the first few days in on this, but you fill the whole week up with how you want to do things. Okay, so a Gantt chart can give you a better work-life balance. So here on Monday, I've decided I'm going to revise topic 1 for 2 hours from 8 till 10, and then I'm going to have a break for an hour. And then I'm going to do topic 2 for another couple of hours, and then I'm going to have a couple of hours break. And then I'll do a final couple of hours on topic 3, and I'll stop before the evening so that the evening is mine to do with what I wish. Then Tuesday and Wednesday, I'm working clinical shifts, so I won't be doing any revision on those days. And then Thursday morning, I'm going to go out with my friends, maybe do some shopping. And then in the afternoon, when I come home, I'll do a couple of hours on topic A and a couple of hours on topic B, and so on and so forth. So you actually divide your week up so that you have covered however many topics you want to cover in that week. But you have also given yourself time to relax, time to do other things. If you have children, then factor in, time with your family and your children to within this, because it can become all-consuming when you're revising for exams, and that's not healthy either, not to be able to really break that up. And you'll find if you do your revision in short bursts, you will probably remember much more than if you sit there for 4 or 5 hours just, reading your books and trying to revise a particular topic. So mind maps, again, these are a short, snappy way of getting information onto a piece of paper to help you revise. So you put your subject in the middle, and then you have as many boxes around it, or little lines going off it, spider diagrams, whatever, with each of the key points. So you remember right at the beginning I was saying, write those key points down about each subject. These can be quite useful. And then you can either just keep them as they are, or you can do what I'm going to show you with the next one, which is one of my favourites, to try and remember key things. So with this one, the visual tools, so this one I used a lot and used to use a lot with my students, particularly for remembering pre-op drugs. So you write yourself a nice little table with the drugs on, their dosage, their route of administration, and what they do. And then you cut this up. You cut them all up, so you essentially make a jigsaw, and then you put them back together again. And so again, you can do exactly the same with your mind map. You can cut this up and try and match up the key points. So you could have 2 or 3 subjects together on mind maps and try and match the key points back up with the individual subject that you're revising. Because I can sit and stare at this table all day and think, yes, I know what that is, but then when I have to try and reproduce it, I might get muddled with it. Whereas if I have to put it together like a jigsaw, then I know which drug is which dose and what it actually does, if that makes sense. So in conclusion, it's really important that you're organised with your revision for exams. As I say, use the Gantt chart or something similar so that you have actually made a plan for what you're going to do revision wise. Don't revise the same things over and over again. And I say, because if you're revising stuff you clearly do know, put those to one side. Focus on the things that you are less familiar with. Don't overstretch yourself. So don't give things, don't give yourself too many things to do in a day or a period of time. Definitely don't leave it till the last minute unless you're one of these very, very fortunate people that can manage to cram it all in at the last minute, but most of us are not. So don't leave it till the last minute. Start revising right from the beginning of learning something. And I know that sounds weird because you sort of think at the beginning of a module, you think, oh, I've got ages before I've got an exam with this, but actually that goes very, very quickly. And trying to fit it in with your clinical working and any other assignments you might have to do at the same time can become quite overwhelming. So if you do a little bit all the time, you are less likely to feel overwhelmed with it. See if you can have a revision buddy. It doesn't have to be in person. You know, we have technology now, so you can buddy up with somebody over Zoom or FaceTime. You don't even have to be, you know, in the same building together now to have a revision buddy to do something with. Use visual tools if they, you know, like the tables and mind maps, if they help your learning. Say, I'm a visual learner, so I find those very useful. And most importantly, have faith in your knowledge. You know much more than you think you know. When we're students, we always think that we don't know anything. Even as a midwife, to be fair, I don't know everything. You know, I'm learning every single day. Evidence changes every single day. So you will, you know, you will never know everything. It's about demonstrating that you have knowledge, which you do, and that you are safe in your practice. So do have faith in your knowledge. Think about what you've done in clinical practice as well as what you've done in uni, and try and link those two up. Because if you can, as I say, if you can actually link a particular condition or situation to somebody you've actually looked after, it makes it easier to actually revise having that particular woman in mind. So good luck. And there you have it, some strategies for revising for exams. I hope you found it useful. If you haven't subscribed to the channel already, please do so. Please spread the news amongst your friends and colleagues, and I look forward to seeing you next time.